Hello, I'm Dr. Abhisekh Dandapath, a consultant psychiatrist from Kolkata, West Bengal. On this Suicide Prevention Day, I'm going to speak about the ways to cope with suicidal tendency, especially in case of depression. We have to remember one thing, that suicidal thoughts come with certain warning signs, and it is also associated with certain risk factors. Some of the warning signs include feeling trapped, hopeless, feeling unbearable physical and emotional pain, more focusing on death, feeling guilt or shame, increased anxiety, withdrawal from friends, family, even from society, and it can also present with extreme anger also in some cases. Talking about risk factors, the most it is most commonly seen that use of substances like alcohol or any cannabis or any other substances is an important risk factor. Other than that, impulsivity or poor self-control is another important risk factor. We have to search for the history of previous attempts of suicidal attempts, previous self-harm behavior, and family history of suicide, history of any mental illness like depression, anxiety, schizophrenia, or any other form of psychosis. Um, Another very important risk factor is the access to any kind of lethal means, like poison, pesticides, firearms, like that. Hopelessness, psychic pain, and anxiety is another important risk factor. Any kind of chronic illness, physical illness, chronic pain, and the patient is in the any cancer, any in his deathbed, will be another alarming risk factor for us. Uh, any history of trauma, any kind of abuse like physical abuse, sexual abuse, any kind of victimization by the peers, and most importantly, we have to uh, find out those individuals, those who are single or divorced, elderly, adolescents, young adults. So these are important risk factors. We have to keep in mind that depression with suicidal thoughts is something one should pay attention to. And if you are currently in treatment for depression, make sure that you should tell that to your therapist or psychiatrist. If you're experiencing depressive symptoms and suicidal thoughts, it is very important to get help. With timely help, depression is treatable and suicide is preventable. Thank you.